So on March 11, 2020, the WHO announced COVID-19 as a pandemic. This led to rapid school closures, restricted access to work environments, and closure of recreational facilities across Canada. On March 15th, the Alberta Health Services, as well as the University of Calgary, recommended work from home to manage with the COVID-19 pandemic and the restrictions that were implemented. This led us, our research lab at the University of Calgary, to initiate a survey to understand some of the challenges that we were noticing with parents as well as children. I also was in the middle of completing my practicum, where we were hearing parents talk about what some of the challenges they were dealing with. So that led us to designing a survey. So we started our survey creation on April 6th. And then within 2 weeks, we designed our survey, had all the documents completed and submitted to ethics. We had a rapid review of the ethics. By March 11th, we had received our ethics approval. And from March 11th to June 15th, our survey was live online. From March 11th to March 26th, we shared our survey through social media. We also had a list of parent contacts from previous studies to ask them if they were interested in answering questions. We also shared our survey to about 35 clinics in all over Canada that were related to ADHD services. We received about 587 survey responses from parents all over Canada, which led us to meeting beyond actually our target goal. So we closed our survey after 5 weeks. From June 16th to July 15th, we did our initial data analyses. Very recently, October 5th, we had submitted our first manuscript for peer review based on our survey data. And today we're excited to present some of our initial findings and sharing it with all of you. Next slide, please. All right, so I'll just talk about the method. So because of COVID-19, we had to ensure that we used a modality that was accessible for everybody. So it was an online survey we created using Qualtrics. Now, Qualtrics is a freely available software for staff and students at the University of Calgary. So we were able to use that. As I mentioned, we distributed the survey to families using research websites that we had created, a research website we created, but also through direct email contact and social media. We collected data for 5 weeks from May to June 2020. A total of 587 surveys were completed. And the time it took parents to answer these questions were approximately 30 minutes. It was a decent amount of time requirement for families. Next slide. In terms of responses, so we received the majority of our responses were from Alberta, about 40.9%. Then it was Ontario with a close 31.3%. And then we also received responses from all the provinces and one territory, but we were not able to receive any survey responses from Northwestern Territory as well as Nunavut. Briefly going over the demographic of the survey. So the age range that we were targeting for the children were about 5 to 18 years old. So even though it was a parental survey, we asked the parents to answer questions about their child. Our mean age for the kids involved were 10 years and 10.11 years. In terms of the gender distribution, it was what we would expect, the 3:1 ratio, so more about 70% males and 30% females. In terms of ethnicity, again, we're not surprised. We had 80% responses from Caucasians with about 5.3% First Nation Métis population, and then 14% indicated other, and other could be mixed race or any other Black, Hispanic, Asian, could be any of the following. In terms of household income, so we had 18.1% report income that were at the median, 2017 Canadian median family income range. About 44% were above that, were below that median, and then 37.3% were reported incomes above that median. We also were interested in just measuring what the handedness of the kids were they left or right-handed. About 80% were right-handed. Next slide, please. We asked families to report what some of their comorbid diagnoses were. So anxiety disorders were the most prevalent, along with the ADHD confirmed diagnosis, followed by depression, and autism spectrum was the third highest comorbid diagnosis reported. Next slide. Now Rose will go over her presentation.
Thank you, Tasmia. My name is Rose Swansberg. I'm a research coordinator at the Alberta Children's Hospital in Calgary, and I'm going to share the mental health and lifestyle impacts from this survey that Tasmia just introduced. So we asked after 3 specific mental health symptoms: anxiety, depression, and ADHD. And we analyzed our data at the whole sample level of 587 respondents, then also separated by gender of male and female, and by age category, 5 to 8 years, 9 to 12 years, and 13 to 18 years old. Interestingly, more young children, and in particular more young girls, were showing increased anxiety symptoms compared to young boys. And more boys were showing increased ADHD behaviors compared to girls, at 55% of males showing an increase in these ADHD symptoms compared to 44% of females. Next slide, please. We used the PHQ-9 to assess depression symptoms, and 17.4% of children met criteria for moderately severe to severe depressive symptoms, which is a PHQ-9 total score of 15 to 27. Of those who were showing depression symptoms, caregivers reported that 96% of their children were showing an increase in their child's depression symptoms, and 42% reported that these depression symptoms were making it very or extremely difficult for their child to do work or get along with others. When we looked at the PHQ-9 total score of the extreme severity, which is 20 to 27, more males than females were showing criteria for severe depression at 7% of the male population and 2.5% of the female population. Children who had comorbid depression or sleep disorders showed a significant increase in depression symptoms compared to children who did not have these comorbid diagnoses. Next slide, please. We used the GAD-7 to assess anxiety symptoms, and 15.4% met criteria for moderate anxiety and 14.1% for severe anxiety during the COVID-19 pandemic, specific to our survey response time of May to June. Of those exhibiting anxious symptoms, 87.5% of caregivers report an increase in their child's anxiety behaviors, and again, this impacted young females more than young males. 39% of caregivers claimed that these anxious symptoms made it very or extremely difficult for their child to do work or get along with others. And children who had comorbid anxiety, depression, or sleep disorder showed an increase in anxiety symptoms compared to children who did not have these comorbid diagnoses. We used the SNAP-4 26 question scale to assess ADHD symptoms. 73.7% of children met criteria for inattention. 66.8% met criteria for hyperactivity impulsivity, and 38.6% met criteria for oppositional defiance. 57.7% of caregivers reported change in their child's ADHD symptoms during the pandemic. And of these, 93% reported more ADHD-like symptoms, and again, impacting males more than females. 55% of caregivers report that their child's ADHD symptoms made it very or extremely difficult for their child to do work or get along with others, and this impacted younger children more than older children. Children who had a comorbid diagnosis of oppositional defiant disorder had increased ADHD behaviors compared to children without oppositional defiant disorder. We asked after specific treatments during the pandemic. 33.6% of children were participating in therapy, with proportionally more girls than boys in therapy. 69% of those in therapy, which was 224 children, reported access to their therapist changed with COVID-19 onset. Therapy moved online for 33%, onto the phone for 23%, or stopped completely for 34% of the population. We asked after specific types of therapies, including social skills training, parent behavior training, and cognitive behavioral therapy, and we found age and gender differences only for cognitive behavioral therapy, with more youth 13 to 18 years participating than younger children, and more females than males participating in cognitive behavioral therapy. 74% of children were taking ADHD medications during the pandemic, with more boys taking medication than girls, at 77% of the male population and 66% of the female population. 35% of the caregivers reported a medication dosage change that impacted females more than males and younger children more than older children. Dosage increased for 15%, decreased for 7%, or stopped completely in 5% of the population. We asked after specific types of medication that children were taking, including Ritalin, Concerta, Strattera, a whole list of them. More males were taking Intuniv than females, and Concerta was consumed more by youth than younger children. 11.5% of caregivers reported difficulty filling their child's medication during the pandemic, and 27% of children were taking medication breaks, such as a weekend free of medication. We asked about sleep habits, eating habits, exercise, and screen use during the pandemic, and caregivers reported changes in their child's sleep in 78% of the population, eating habits for 59%, exercise in 84%, and screen use in 93%. And importantly, all of these factors impacted youth 13 to 18 years the greatest. Next slide, please. Sleep habits changed with a shift. 65% of children were going to bed later and 45% were waking up later during the pandemic. We asked caregivers when their children were going to bed and waking up, and we found that the majority of children were meeting American Academy of Sleep recommendation guidelines of hours of sleep a night, but there's this huge shift in when they were sleeping. And the gray bars represent youth 13 to 18 years, showing the greatest changes in sleep habits. For example, 79% were going to bed later, 65% were waking up later, and even 16% of youth were taking more naps during the day during the pandemic time. 49% of children were exercising less often, with youth showing the greatest decrease in play and athletic activities. The green box highlights daily average of 30 minutes to 2 hours of exercise. For blue bars are gentle physical activity, orange bars moderate to intense physical activity, and gray bars were highlighting indoor exercise. Canadian activity guidelines are to do 60 minutes of moderate to intense physical activity and several hours of light physical activity each day, which the majority of our responses were not meeting. Children 5 to 8 years were doing the most gentle physical activity, and children 9 to 12 years the most moderate to intense physical activity, but still not meeting these Canadian activity guidelines. Screen use increased. 87% of caregivers reported that their child was spending more hours a day on a screen, and only 1% reported fewer hours a day on a screen. Again, Canadian activity guidelines are to spend less than 2 hours a day of recreational screen time. And the red box is highlighting the different screen activities that were occurring more than 3 hours a day. So for example, 54% of youth 13 to 18 years were playing video games more than 3 hours a day and watching TV more than 3 hours a day for 30%. Youth spent the most time on screens. And in particular, youth would spend a lot of time on smartphones versus younger children spent a lot of time on tablets. Females spent more time on audio and video calls than males, and males spent more time playing video and computer games than females. We did a preliminary qualitative analysis of comment columns in our survey, and we want to highlight that not all children were struggling. Some children were doing better. For example, my child hated school, life at home is generally better, much calmer, less anxiety, self-isolation helped us reconnect. But then other caregivers reported like huge increases in anger, tears, frustration. Their child was bored and isolated. Their child didn't have any outlets for energy. We need access to recreational activities. We need emotional and childcare relief. And so there was a huge need for respite that was highlighted in this preliminary qualitative analysis. We want to highlight that not everyone was doing poorly. Some children were really doing better during these times. Other research that has occurred during the COVID-19 pandemic includes a study in China in February that reported that the average behavior of their child with ADHD was significantly worse since the onset of the COVID-19 pandemic than their child's normal state. A study in Japan with 15 children showed increased hyperactivity, impulsivity, and inattention scores from before the COVID-19 pandemic to assessments during the pandemic. A study in France between days 20 and 30 of the country's lockdown reported 34.7% of their ADHD children were experiencing a worsening of well-being, 34% showed no change, and 31% were doing better. The United Kingdom found that children with neurodevelopmental disorders, which included ADHD and autism spectrum disorders, had a significantly higher prevalence of emotional symptoms, higher conduct problems, and lower prosocial behaviors than typically developing children during the pandemic period. A Statistics Canada report in August of 2020 showed higher rates of mental health, loneliness, and academic concerns from parents of children with disabilities, which included cognitive and physical disabilities, than parents of children without disabilities. And then I've highlighted the China longitudinal study because it's the only longitudinal study I've come across thus far versus these cross-sectional analyses. It was not in a neurodevelopmentally diverse population, but they found an increased depressive symptoms, self-injury, suicide ideation plan, and attempt in children aged 9 to 15 from before the COVID-19 pandemic to 2 weeks after their schools reopened in May. And the Raising Canada 2020 report found that suicide is now the leading cause of death in children 10 to 14 years, and the second leading cause of death in youth 15 to 24 years. And so if this is a true finding in other countries, and we're seeing increased depressive symptoms, suicide ideation, and attempt, this is a huge need we need to identify and respond to. So, in summary, our survey showed similar results to other research studies investigating the impacts of the COVID-19 pandemic on children, including increased depressive symptoms, anxiety symptoms, inattentive and hyperactive behaviors. We saw lifestyle changes with decreased exercise, increased screen use, and shifts in sleep patterns, in particular impacting youth 13 to 18 years. And children were not meeting Canadian activity, movement, or screen use guidelines. Finally, the Children's Lifestyle and School Performance Study in Nova Scotia, which was published earlier this year, found fewer physician visits related to ADHD in children who followed lifestyle recommendations, including eating patterns, exercise, and screen use, than children who were not meeting those recommendations, which highlights the need for us to be ensuring we can help children live these healthy lifestyles. And now I will pass it back over to Tasmia.
Yes. Hi, everybody. I'm back again. Next slide, please. All right, so the objective of this specific section was to describe the changes in learning and educational services that was taking place during the initial phase of the pandemic, so from May to June. We also wanted to describe the transition to online learning that went for students, specifically in the K-12 system with ADHD. All right, so the first, so again, these are very preliminary results. So the first thing we asked parents was, is your child receiving web-based learning from the school or the teacher? And about 90% reported yes, they were. So that indicates that about a 10%, a small percentage of students were not receiving any online learning at that point. Now, we do have a comment section where we asked parents why. We're still on the verge of answering some of those and analyzing some of those questions. But one of the explanation that I remember reviewing was that they just had a lot of too many siblings in the household to actually handle doing online learning because the parents have to supervise. Next slide, please. Then we asked who was the primary person supporting children's learning at home, and about 89.5% was parent, with teachers being the second, which was about 4.8%. So a huge burden on parents to be the primary person supporting children's learning. Next slide. We then asked on average how many hours a week was the child doing schoolwork. So about 41.4% of the parents reported that their child was engaging in less than 5 hours of schoolwork. About 36.2% indicated between 5 to 10 hours of doing schoolwork, which is substantially a reduction in weekly instructions. Typically, Canadian, on average, they receive about 5.5 hours of direct instruction per day. So that's a huge reduction. If you think about it, these are average weekly numbers. Then we asked parents to report if their child already had a learning disorder diagnosis. And you will notice that about 40% of the sample indicated that their child with ADHD had a learning disorder diagnosis, with multiple learning disorder being the most prevalent learning concern. Next slide, please. One more. There you go. All right, you can click one more again. All right, so then we asked parents to indicate just a yes or no question if their child was experiencing difficulty with executive function skills. Again, this was just a yes or no question, and about majority of the parents indicated that their child was struggling with starting tasks, managing their time, and staying organized. These are some of the skills that in the school, at least, the teacher is keeping up with the students to make sure that they're actually starting their tasks, they're managing their tasks so that they can, do their next thing that they have on their to-do list. Also, I hear from the teachers all the time that, they buy binders, they have these dividers, all of these things that helps the child stay organized typically with their, academic learning. We then asked parents what made online learning challenging. So we wanted to focus, apart from just ADHD related symptoms, were there other things that was impacting them? So again, 81% of the parents reported that yes, they were having difficulty staying focused. But what I also found interesting was to look at something like having to share laptops of computers with others was something that was impacting their online learning, as well as having internet bandwidth. I know personally, I had to upgrade my internet so that I can accommodate all these Zoom calls. So it's a common problem that we need to really address during these times. Next slide. Then we asked if the child was receiving educational materials that was meeting their specific learning needs. Given that about 40% of the sample had a additional learning disorder, it was important for us to address this. And so as you can see, about only 40% of the parents actually reported saying that yes, they were receiving learning materials that were meeting their goals. So that's a substantial amount of students that were not addressed, were not meeting their learning goals or receiving learnings that were actually engaging for them because it was maybe too difficult or too easy for them. Lastly, we asked parents to say if they noticed that their child was finding online classes challenging, and about 27.1% of the parents reported that their child was finding online learning very challenging, and at 32.8% were reporting extremely challenging. What's interesting is a small minority, 7.1% of the parents indicating that the child was not finding online learning challenging at all. And as part of the paper that we submitted, we looked at some demographic information as well as mental health symptoms, if that answered or if that correlated with them not finding online learning challenging. And we noticed that depression symptoms appear to be sort of a significant correlation. Again, it is a correlation, but I think it's something that we can look into further. Next slide. So overall, our survey responses indicated that 90% of the children were receiving web-based learning. That means about 10% were not receiving any online learning at that point. Students were engaging in reduced hours of online instructions. Most of them were not receiving learning materials that were meeting their modified curriculum or individualized education plan. Parents reported significant challenges in adjusting to online learning. And then lastly, there is a struggle with implementing some of these executive function skills. Now, as online learning is ongoing, having being part of a school board now, I'm hearing that there is more shift to online learning every day. So it would be interesting for us to actually monitor what's happening with these kiddos and how are they managing it, and what can we do to supplement and support the teachers making online learning engaging for the students.